This is a video about sternum. Sternum is a flat bone forming the anterior median part of the thoracic skeleton. It is like a short sword. The upper part corresponds to the handle of the sword called the manubrium, and the middle part resembles the blade of the sword called the body. Lowest tapering part is the xiphoid process or xiphi sternum. Sternum is about 17 centimeters long and it is longer in males as compared to females. So, if we talk about manubrium, the first part, it is quadrilateral in shape. It is the thickest and strongest part of the sternum. It has two surfaces, anterior and posterior surface, and four borders: superior border, inferior border, and two lateral borders. The anterior surface is convex from side to side and concave from above downwards. And its posterior surface, it is concave and forms the anterior boundary of the superior mediastinum, as this is the level of the transthoracic plane dividing the mediastinum into superior and inferior part. So the posterior surface of manubrium forms the anterior boundary of superior mediastinum. So the superior border of Manubrium sterni is concave, and you can see this concavity. It is called the suprasternal notch or jugular notch. When we go laterally on both sides, we can see another notch that is for articulation of medial head of clavicle to form the sternoclavicular joint. The inferior border forms a secondary cartilaginous joint with the body of sternum. This is called manubriosternal joint. And manubrium makes a slight angle with the body and is convex forwards, and it is called the sternal angle or angle of Louis. The lateral borders, they have facets on both sides for articulation with the first rib. This is the uh, costal cartilage of first rib that articulates with the first costal facet on the side of or lateral side of manubrium. Second facet is a demifacet, that is, it is a half facet which completes uh, by forming a circle with another demifacet on the side of the body of the sternum. So the second part is the body of the sternum. It is longer, narrower, and thinner as compared to the manubria. It is widest close to the lower end at the level of fifth costal cartilage, and it has two surfaces, anterior and posterior, and it has two lateral surfaces. The anterior surface is nearly flat and directed forwards and slightly upwards, and it is marked by three ill-defined ridges which show the fusion of the sternibri. The posterior surface is slightly concave and is marked by less distinct transverse lines. The lateral borders, they form synovial joints with the lower part of second, third to sixth costal cartilages and upper half of seventh costal cartilage. The upper end, it forms a manubriosternal joint, that is secondary cartilaginous joint with the manubrium at sternal angle, while lower end is narrow and it forms primary cartilaginous joint with the xiphi-sternum. So xiphoid process, as you can see the xiphoid process. The xiphoid process is the smallest part of the sternum. It is at first cartilaginous, but in the adults it becomes ossified near its upper end. And it varies greatly in shape and may be bifid or perforated. It lies in the floor of epigastric fossa. So if we talk about the attachments on sternum, firstly we'll discuss the attachments of muscles and ligaments on the manubrium sterni. So on the anterior surface, there is attachment of pectoralis major. This is the attachment of pectoralis major on the anterior aspect of manubrium and the body. Then the sternal head of sternocleidomastoid attaches on the upper part of anterior surface on both sides. Here will be the sternocleidomastoid. Then on the posterior surface, there is attachment of sternohyoid in the upper part and sternothyroid in the lower part. And the lower half of this surface, it is related to arch of aorta, and the upper half is related to the branches of arch of aorta, that is the brachiocephalic artery, left common carotid, and left subclavian artery, along with left brachiocephalic vein. The lateral portion of this surface are related to the corresponding lungs and pleura. The suprasternal notch gives attachment to the lower fibers of interclavicular ligament and the two subdivisions of investing layer of cervical fascia. So the margins of the clavicular notch, this is the clavicular notch. Margins of this notch, they give attachment to the capsule of the sternoclavicular joint. Now the attachments on the anterior and posterior aspect and lateral side of the body of the sternum. So the anterior surface gives origin on either side to the pectoralis major muscle, as this large muscle arises from anterior aspect of manubrium and the body of sternum. Here you can see the pec major arising from manubrium sterni and the body of sternum. Now the posterior surface, the lower part of posterior surface, it gives origin on either side to the sternocostalis muscle. We can see in this model, if we see internally, this is the posterior aspect of body, and you can see the radiating fibers of sternocostalis os or transversus thoracis. Then in between the facets for the costal cartilages, we have this surface of the lateral aspect of sternum. Here is the attachment of the aponeurosis or membrane of the external intercostal muscle and muscle fibers of internal intercostal muscle. If you see these intercostal spaces, if you visualize a whitish membrane anteriorly, this would be of external intercostal muscle, and if you're asked about the muscle fibers, those would be of internal intercostal muscle, as the muscle fibers of external intercostal muscle are deficient anteriorly. Then attachments on the Xiphoid process. On the tip of the Xiphoid process, we have the attachment of linea alba. This is the white line. And then rectus abdominis muscles, medial fibers, they are attached to the lateral sides of the anterior aspect of Xiphoid process. And on the posterior aspect of the Xiphoid process, there is attachment of sternal head of diaphragm. And on the lateral side, there is attachment of aponeurosis of internal oblique and transversus abdominis muscle.